is emergency information if Basil's button comes out of his tummy. It's incredibly unlikely, but it would be an emergency, not because it would be life or death. He's not going to bleed out or die or anything. But if the hole closes, then he'll need another surgery to replace the button. So we want to get a replacement button in right away. This bag, called emergency G-tube supplies, is in the bottom of his diaper bag at all times. Inside are instructions, and they're great. They've got a QR code to a video. We've got pictures, but our supplies don't look exactly like theirs, so I'm still going to make this video. Instructions, a small syringe, a large syringe, a replacement button. I stuck both of these in the same baggie just to save space. A little bottle of sterilized water. A little pack of lubricating jelly for sticking the new thing in. A couple of woven gauze sponges and medical tape. And you hold up so you get a good look at the button. So this is the part that's visible. You usually see it from above, like this. This is the part that goes in, and this at the bottom is a little balloon that when it's in his stomach is filled with that sterilized water, and that keeps it in. So, like I said, it's not like a bleeding to death emergency. You can take a breath and take a minute and bring up this video, search your email for Basil emergency and find this email, and wash your hands. It's the first step. It's okay to take time to do that. Stomach contents will slowly seep from the hole. It'll be a little bit gross, but he's going to be okay for a few minutes. I think you even have up to a few hours before the hole closes, but obviously sooner is better. So that was step 1, wash your hands. Step 2, draw 4 milliliters of sterile water into the small syringe. So that's ready to go, 4 milliliters. Then on the instructions, step 3 doesn't apply to our kind of button. I crossed the whole thing off. Step 4 is you take the lubrication and the new button. I'm not getting it out because I don't want to contaminate it. And this part that's going to go into the hole, you're going to put lubrication on that so it'll slide in easy. And the nurse gave me a tip in the hospital. You tear off the end and then just stick the end of the button straight into here, and that way you're not like trying to squirt it and spread it with your fingers or something. Then step 5, just put it in, gently stick it in. And the shape of the button is really nice. You just stick it in until this is laying flat on his skin. In the instructions, they're trying to tell you specifically how far to put it in because they're talking about like a straight tube with nothing to stop it, but ours is much better. Step 6. Before I explain it, there's 2 ports here. This port at the top is what we use for feeding. That's what most people are familiar with. This on the side is the balloon port. So it goes straight to the balloon that holds it in. Step, whatever we're on. Step 6 is you take that syringe that you filled with water, you put it into this balloon port, and you push it in. Push the water in. That'll inflate the balloon with sterile water and keep the button in place. The syringe This looks like a screw-in syringe. That's new. Sorry, I was looking at that for so long. The syringe kind of screws in to the balloon port, and you push the water in, and then when you try to take the syringe out, you have to keep your finger on the plunger, make sure water doesn't come back in before you get the syringe off. I have to replace the water in his button regularly, and our syringes don't look exactly like this. It works, obviously. This is made for this purpose. That's just why I was looking at it for so long. That was number 7, with your finger on the plunger. Twist off the syringe. Step 8, test that the balloon inflated by gently pulling up on this and feeling some resistance. It should come up a tiny bit. There's, he's gonna get mad if I pick him up and show you. He wants to keep playing. But you usually can pull it up a little bit, and like you could fit a quarter under there, easy. Again, there's a step that doesn't apply to us, so I cropped the whole thing off. And then the last one is, you've already tested that it's in, now we're going to test to make sure that it's working, that this port is going to lead into his stomach. So you take the big syringe, right here, and you stick it straight into here. Usually we use a feeding tube to connect, but this time you're just going to stick it straight into this hole. And you're going to gently pull up on the plunger until you see stomach contents coming out. His stomach contents usually look like how it looks when it's going in. So if he's recently had yogurt, it'll look white. If he's recently had food, it'll be a murky brown. Because, you know, his food is all liquid anyway. It could be watery. If you get a little air at first, don't panic, it could just be gassy. But shouldn't be much air. Pull back on the plunger. Yeah, that's it. And then it's got a few caveats here. Do not use the replacement tube if you do not get, well, that's not your concern. That's for feeding. But if you don't get stomach contents when you pull it up, or if something else goes wrong, just head straight to the emergency room. If he seems to be in pain afterwards, if it has some pretty obvious things here. If his belly gets big, if it's hard to wake him up, anything else that concerns you, just go to the emergency room. And take the button with you, the one that came out of him and this replacement one, so that if you're going to the emergency room and they're going to ask you, what kind of button does he have? And you're not going to necessarily tell them, oh, he's got a Mickey button, size 14 French, 1.7 centimeters, millimeters, not centimeters, that would be huge. You can just hand them the button, either the one that came out or the replacement one, and they will look at it and see the information. The gauze and the tape are just in case. If there's a mess, or if it came out because he's bothering it and you want to just tape a big thing of gauze over his button and stop him from pulling it out, just there in case. Alright, I don't expect this will ever happen because we all thought he would try pulling it out in the first week and it's been 6 months, but just in case.